3,855-gram newborn baby is examined shortly after birth, and she was delivered at 40 weeks of gestation by cesarean delivery because of breech presentation. Pregnancy was otherwise uncomplicated, and physical examination shows asymmetric thigh crease. The left leg is shorter than the right leg and positioned in external rotation. Which of the following is the most likely cause of the patient's findings? Okay, so what points to this? So whenever they say that there's a breech presentation, it's a clue to this diagnosis, because usually this happens in newborn babies in breech presentation. Okay, so in such young age, if there is an asymmetric thigh creases, which is very characteristic, and there is asymmetry in the limb length also, this is very characteristic in a newborn baby, especially if they've mentioned breech presentation. Close your eyes and mark developmental dysplasia of the hip. Okay, so there is a very peculiar test that we do to a clinical test that we use to differentiate this diagnosis. It's the Barlow and Ortolani test. Okay, so the Barlow and Ortolani test, in Barlow test, what we do is when the infant is lying and we flex the thigh and flex the knee, and in Barlow test we internally rotate the thigh, or we adduct the thigh and give it a posterior push. Okay, so when we apply a posterior force, if we hear a clunk, if there's a palpable clunk, then it shows it's positive Barlow test. So that shows there is developmental dysplasia of the hip. So in Ortolani test, what we do is so O is out. Okay, so we try to move the limb outside, the one which is already dislocated. So we try to move it outside, and then the acetabular head, it just goes into the femoral head, goes into the acetabulum. So that is the Barlow and Ortolani test, and it's a clinical maneuver which can easily give you the diagnosis of developmental dysplasia of the hip. Okay, so now let's see why the other options are not the correct answers. First is avascular necrosis of the femoral head. What is this called? Avascular necrosis of the femoral head. So there's a particular name for this particular syndrome. Okay, it's called the leg calf path disease. It's a leg calf path disease where there is avascular necrosis of the the femoral head. So what happens is that usually they present with thigh pain, and the normal age of presentation is 4 to 10. So here, since we're talking about a newborn, and of course pain and this motion, all these movements are difficult to assess in a newborn, so we would go for developmental dysplasia. So hip pain which occasionally radiates to the knee, so that's very characteristic in a 4 to 10-year-old child. Then we think about leg calf path disease, and the next option is femoral neck fracture. Of course, these are not very common in newborn. So femoral neck fracture is something which is expected in an elderly male, right? So that's obviously not the answer. And inflammation of the synovium, so that's a transient synovitis, which also cannot be assessed in a newborn baby, because this is a very transient condition which is resolves on its own, or with just supportive treatment like NSAIDs or hot compresses and stuffs like that. Okay, and traction epiphysitis is the Osgood-Schlatter disease, which is not at the hip, which happens at the knee. So there is normally you have the anterior knee pain and point tenderness of the tibial tuberosity. Okay, so that also is not expected in a newborn child. Okay, so this is slipped capital femoral epiphysis, which is also not expected in newborn child. And normally in the question you will have an obese teenager. Okay, so an obese teenager who will have instability of the hip. Okay, so they will have stability of the hip, and there will be movement problems, and the thighs will be externally rotated. So that is the classic presentation of slipped capital femoral epiphysis. So in leg calf path disease, it's usually the thigh pain which radiates to the knees, and here it's more of instability of the hip. That's how you differentiate between the two conditions. Okay, what is the treatment for developmental hip dysplasia? Yeah, it's called the Paulick's harness. Okay, so it's mentioned here. A harness is used. The particular name is Paulick. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.